Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. In this episode, Tony Brown, a PrEP user and advocate, discusses the value of effective patient-provider communication when it comes to PrEP persistence. For the full online educational program, Staying on Track, Strategies to Support PrEP Persistence and Re-engagement, please visit the link in the show notes for this episode. Now let's hear what Tony has to say.
I started taking pre-exposure prophylaxis, PrEP, in 2016 at the encouragement of my former partner. I am still using PrEP today despite no longer being in that relationship. It's become a habit for me, particularly during the time after that relationship when I was learning to be positive about sex and my body. However, over the years, I have dealt with fluctuations in adherence with taking daily PrEP because I've experienced pill fatigue, evolving relationship situations, and fears of medication toxicity and long-term side effects. And I've simply had extended periods of time with no sexual encounters. But if we want to have open and honest conversations, I feel like having open and honest conversations with my provider was essential to support me during these adherence fluctuations. The providers who engaged me the most were those who didn't attempt to sway my decision in any way, but instead sought to provide me with the most current and relevant information. I had a provider who judged me for using the 2-1-1 or on-demand PrEP method. You take 2 pills 24 hours before having sex, 1 pill 24 hours after the first dose, and then 1 final pill 24 hours after the second dose. Instead, they insisted I take it once daily as prescribed. That same provider didn't ask me about my sexual history or regular sexual activities. They just assumed that I would not have the self-efficacy to follow the 2-1-1 instructions and that it would be ineffective with my presumed level of risk. Even when I took the medication every day as prescribed, I still feared a breakthrough infection when being tested for HIV. The various scenarios of what if can be plaguing and paralyzing. These conversations with my provider could be challenging because I feared being chastised or judged by them. What if the medication stopped working for me? What if I missed a dose and some unplanned sexual encounter happened and my provider thinks I'm a complete idiot and is disappointed in me, which really gave me a feeling of personal failure. But what if I have this positive test? What if I contracted a sexually transmitted infection? What if I missed a week of doses because I changed jobs or my new health insurance policy has yet to be established? There were many questions. To overcome doubts like these, to feel comfortable continuing PrEP, I need a provider who engages with me, not one who judges me. It is vital that healthcare professionals have meaningful conversations with their patients about their experiences and encourage health literacy. We, as patients, are often juggling many constantly changing life situations that alter how we value PrEP and may alter our consistency with following a selected regimen. If our providers can establish open and effective communication before we resort to figuring things out independently, they could help us persist on the most effective PrEP regimen for preventing HIV.
Thank you very much to Tony Brown, and thank you to our listeners for joining in. To get more from our program, see the link in the show notes. You can view a foundational video module on PrEP persistence, blogs featuring specific case examples, clinical thought commentaries from people using PrEP, and downloadable PDF resources for healthcare professionals to print and share. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.